So how can you avoid this deficiency? One way that I suggest, and you're going to see this as a recommendation for several of the deficiencies, is environmental rounding. You can look for any hazards or risk on a routine basis with your interdisciplinary team. I suggest that you do this on a weekly scheduled basis, set it up just 30 minutes every week, and have representation from all your departments, from nursing, from administration, from maintenance, from housekeeping, from infection prevention. Just have a variety of people available to go on your environmental rounds. Look at different areas of your building, have a checklist that you follow, and within a certain amount of time, you're going to cover your whole building, and it will be amazing as to what you find as far as risk and hazards that you might identify. And so that's one way that you can eliminate this deficiency. A falls huddle is another way. You want to do that immediately after a fall, after you assess the patient and get them safe. You want to call the team together that was involved with the patient or the resident, and see exactly what caused the fall and look for any preventive measures. Then you're going to look at that individualized care plan and reassess the interventions that have already been put into place, see if they're still effective, and update that care plan as needed. You're going to include your QAPI committee activities as part of falls. You're going to be looking at all your falls. You're going to be looking at trends. You're going to be looking at a complete analysis of your falls, different units, times of day, shifts, all the different factors that can see if you have an area that might need improvement. So again, your QAPI committee is going to be definitely looking at falls. Staff education, again, you're going to be seeing in a lot of the recommendations, you're going to be educating your staff on prevention of falls. That's very, very important. Some other things that you might want to look at that are not on this slide, equipment repair. Sometimes equipment can cause falls. So you want to make sure that you have a good lockout, tagout policy and procedure, and that you actually practice that. You don't want faulty equipment around. You want to make sure that you are providing supervision to your residents. We're going to be talking about alarms in just a few minutes. And then also provide non-slip socks to your residents. And encourage the use, and also look at their shoes and make sure that they don't have slippery soles. So those are just some ways that you can prevent falls. Again, not all falls will be prevented, but we want to try to avoid as many falls as possible.